Inflammatory bowel disease, IBD, is a collective term for a particular group of intestinal disorders, such as Crohn's disease and ulcerative colitis, giving rise to inflammatory swelling and ulceration in the intestines. The key symptoms of IBD are tiredness and fatigue, pain, and urgency in going to the toilet. Many people with IBD often become anemic and show symptoms of ongoing fatigue or tiredness, exhaustion, and weakness. In the past, anemia has drawn far less attention than the causes of other symptoms related to IBD, such as pain, diarrhea, fever, and rectal bleeding. Better understanding of how common anemia is and its impact on patients' lives allowed healthcare professionals and patients to now recognize and treat anemia more appropriately. Anemia is one of the most common complications affecting people with IBD. Nevertheless, anemia is still underdiagnosed. An estimated 1 in 3 people with active IBD are anemic. However, not all are regularly tested and treated before the anemia becomes severe. This is partly due to the fact that in most cases, the symptoms of anemia increase gradually and often are not suddenly obvious to the patients. In addition, it is sometimes hard to tell the symptoms of anemia and the symptoms of IBD apart. It is a good idea that IBD patients should be tested routinely for anemia, because anemia can be effectively treated, often lessening the burden of IBD. The symptoms of anemia are different for each person. Quite often, the symptoms are difficult to describe and can affect one or more body systems. In severe cases, these symptoms can affect daily activities and one's personal and professional life. Frequently, anemia is accompanied by symptoms affecting the central nervous system. Many patients feel worn down by fatigue due to anemia. Fatigue is a severe tiredness that does not go away even after lots of sleep and which might affect daily life. This is complicated by the fact that anemia and fatigue can be accompanied by poor concentration and memory, dizziness, drowsiness, and headache. In very severe cases, the symptoms of anemia can cause breathlessness and may also impact on the heart, causing a rapid heart rate and/or chest pain. People with anemia may feel weak and in females, anemia can affect the menstrual cycle and thereby reproduction. Anemia can also impact on the immune system, leaving people with anemia potentially vulnerable to infections. Many people are not aware that the symptoms described here are signs of anemia. Quite often, people with IBD may accept and adapt to a number of these symptoms or consider them to be just part of their underlying IBD. What they do not realize is that there is effective treatment for the anemia which could improve their quality of life. Therefore, it is worthwhile to check with your doctor to address possible early symptoms of anemia and treat them if needed. Causes of anemia and fatigue. Red blood cells are filled with a protein called hemoglobin, the main function of which is to transport oxygen from the lungs to cells. Anemia occurs when the number of red blood cells is too low or when the hemoglobin content of these cells is reduced, causing a shortage of oxygen availability. There are several different types of anemia, which are caused by a variety of underlying conditions. The most prevalent types in people with IBD are anemia due to iron deficiency, anemia caused by chronic disease or inflammation, anemia due to vitamin deficiencies, drug-induced anemia. By far the most common type of anemia in IBD is due to iron deficiency. The iron in the hemoglobin molecules acts as reversible docking sites for oxygen. This allows the hemoglobin in the red blood cells to pick up oxygen as they pass through the lungs, which can then be delivered to the cells in the body. If there is not enough iron, there is less hemoglobin available in the red blood cells. Therefore, less oxygen can be transported from the lungs to the cells. thereby causing some of the symptoms, like fatigue. The iron cofactor in hemoglobin, i.e. the heme, gives the red blood cells their color. An iron deficit may therefore be reflected by the formation of weakly stained red blood cells in the bone marrow. The detection of circulating so-called hyperchromatic red blood cells therefore may indicate iron deficiency anemia. The important clinical issue is why people with IBD develop iron deficiency in the first place. There are three possible reasons: blood loss, malabsorption, inflammation. One reason iron deficiency develops in IBD is because there is a constant loss of small amounts of blood in the digestive system, and iron may be lost faster than the body can replenish it. The amount of blood loss is dependent on the severity and type of IBD. Iron in the body must constantly be replenished from the food we eat. Another reason iron deficiency develops is because we may not eat enough of it in our diet. People with IBD sometimes have problems eating food rich in iron, as they find it aggravates their digestive system. Additionally, IBD results in a decreased absorption due to damage in the intestine walls. A third cause of iron deficiency anemia is inflammation. The absorption, transport and storage of iron is reduced when the bowel is inflamed, such as in IBD. Another type of anemia associated with IBD is anemia of chronic disease, or sometimes referred to as anemia of inflammation. This is basically driven by the immune system and is caused by the chronic inflammation and immune activation typical in Crohn's disease or ulcerative colitis. Inflammation affects the production of hemoglobin and thereby the amount of red blood cells produced. In addition, it reduces the lifespan of red blood cells. Another issue is the reduced absorption of iron in the intestine. Less common causes of anemia in IBD are anemia von vitamin deficiency is most commonly caused by a lack of vitamin B12 or folic acid, as well as anemia due to the side effects of drugs used to treat IBD. Diagnosis. Often, moderate anemia and iron deficiency lacks any noticeable symptoms. Therefore, they are not diagnosed unless routinely screened for or if the symptoms become rather severe. It is estimated that every third patient with active IBD is anemic. The diagnosis of anemia is based on well-defined criteria carried out through a blood test. The parameters which are often tested are hemoglobin, serum ferritin, transferrin saturation. According to current recommendations, patients who have active IBD or are in remission should be checked every 6 to 12 months. In severe cases, a more frequent interval could be advisable. Test results and treatment recommendations for children, women and men differ. Generally speaking, anemia is considered severe if the hemoglobin level in the blood drops below 10 grams per deciliter. The ferritin level in the serum indicates how full the iron stores are. During active inflammation, a level below 100 micrograms indicates that the iron stores are mostly depleted. In patients in remission, the serum ferritin level should be above 30 micrograms. The transferrin saturation level is a test to measure the amount of iron that is being transported in the body. In the healthy population, this level is 20 to 50%. Prevention. Following a balanced diet and taking the IBD medication in a correct and consistent fashion can help to keep you healthy. This will also support a balanced iron metabolism and help to prevent the development of anemia. In general, the body utilizes about 20 to 25 milligrams of iron each day in order to produce the mean daily amount of 6 to 8 grams of hemoglobin needed. Even without IBD, it can be difficult to achieve the recommended daily amount, which is why iron is stored in the body. The iron which is found in food can be one of two types. Heme iron is found in meat, poultry and fish. Non-heme iron is mainly found in plant sources such as cereals, pulses, vegetables and beans. Heme iron is more easily absorbed by the body. Some foods might prevent the body from absorbing iron, so it might be best to avoid them. Examples include coffee, tea, dairy, white and whole grain flour products. On the other hand, vitamin C rich foods help to absorb it. In many cases, anemia accompanied by fatigue can be successfully treated. The objectives of treatment are to help people with IBD feel better and to restore a good quality of life. Oral treatment. Iron in tablet, capsule or liquid form can be taken to treat iron deficiency anemia or IDA. This type of treatment is recommended particularly for patients in remission and with a mild anemia or iron deficiency before anemia develops. They are easy to take and can help to restore your body's iron levels. Oral iron therapy can take some time to restore your iron levels, because with oral iron, as little as 10% of the supplement is absorbed by the body. The rest just passes through the digestive system, and even more so when disease activity is high. Because of low absorption or high blood loss due to disease activity, tackling anemia with oral iron is slow. This means patients would have to take their medication regularly and for a long time. This may not be easy for some people with IBD because oral iron might make you feel ill, and during flare-ups, oral iron supplements may make the IBD symptoms feel worse because of the leftover iron that is not absorbed. There are many preparations of iron supplements, and they differ in how to take them. Usually this is just before or with a meal. However, certain foods and other medications or supplements can reduce iron absorption. Your doctor will advise you if some of your other medication might make the iron supplement less effective. Certain food will also lower absorption of iron. Iron pills or capsules might not be suitable when the anemia is too severe, when an IBD flare-up might mean it's not absorbed, or when the person feels ill when taking them. If oral iron does not suit you, or you cannot tolerate it, other treatment options, such as intravenous iron, are available. The treatments are usually given in hospital or at a doctor's surgery. Iron can be given through an infusion or an injection. This has the advantage that the iron is delivered directly into the bloodstream, where it is immediately available, and the digestive system is bypassed, thus avoiding irritation or inflammation. Once in the bloodstream, the body can take up and use the iron quickly, and this is a more rapid way of providing iron for hemoglobin and red blood cell formation, thus correcting the symptoms of anemia. Many people find that there are fewer side effects with this type of treatment rather than with oral iron, although some people may still experience some side effects or reactions, depending on the preparation that your doctor has chosen. Depending on the severity of the anemia and the iron deficiency, the treatment may have to be repeated several times. Some drugs are designed so that larger amounts of iron can be given more rapidly at a time, so that less frequent and shorter administration times are possible. Other treatments, such as erythropoietin injections or blood transfusions for severe anemia, are only called for under exceptional circumstances. In emergencies such as severe bleeding, or bleeding over a long time, blood transfusions might help, but they do not correct the causes of anemia. Speak to your doctor about anemia and your treatment options.